out your mouth.
Hello and welcome to our HTV dental program as we welcome in our expert, Dr. Ryan Walker. Welcome to the program.
Thanks, Keith. Thanks for having me.
All right, very good. Look, one of those things that people do all the time, they clench and they grind, but you've got some answers for us and maybe some examples about how we can kind of prevent and work on that.
Right. So today's segment, we're going to talk about tooth wear, which is one of the many symptoms of clenching and grinding.
Okay.
So a lot of people believe that as we age, that teeth wear. I'd like to challenge that theory. Clenching and grinding happens at night.
Mhm.
All right. And what you're losing is tooth structure made of enamel. Enamel's is the hardest substance in the body,
Right.
harder than bone. So most people think when they look in the mirror and they see teeth wear and that, oh, that's just normal. I'm just aging. So I have a few pictures of people of different ages, and just want to go through them and
Okay.
let you know that that's not normal for teeth to wear.
All right.
So this is a 17-year-old, and you can see how the canines are coming together,
Mhm.
and he's starting to wear enamel on that canine right there.
Yep.
All right, same patient. Opening, you can just see that flat edge of that canine. That is tooth wear. That doesn't happen during the day. That happens at night. You
Night.
can generate up to 10 times the amount of forces at night that you can during the day.
Wow.
Takes a lot of force to lose enamel.
Hmm.
All right, so let's look at the next person. This is a 46-year-old.
Right.
You look at this mouth, you don't see any wear, you don't see worn canines, you don't see worn teeth. Next picture. All right, this is a 62-year-old that has the majority of her tooth structure still there. We see a little bit of chipping, but for the most part, she has most of her enamel. She hasn't worn it away.
Right.
So don't just accept that tooth wear comes with age. It can be prevented.
Okay. And so the second thought would be, what should people look for or help identify that they are losing that tooth structure?
So you can look in the mirror and you can go side to side as you do this way, front
Right.
and back, and you'll see that the teeth, when you wear, they line up. They have little what we call wear facets.
Okay.
But they'll go together like a little puzzle. So
Okay.
you can see here on this patient that on that canine right there, there's a little V at the bottom that the canine is worn into.
Right.
And then we go to the next picture, we can see how they come together perfectly.
Got
All right.
you.
So you see that's 100% from clenching and grinding,
Mm.
and she is losing tooth structure. This is the same person's front teeth, and you see once you start seeing the little brown center of the tooth, that's dentin, and you've
Mhm.
already lost 2 millimeters of enamel.
2 millimeters that have
Yep.
come
So
off.
here's the same patient's bottom teeth. We can see that there's dentin showing, and she's worn enamel off.
Wow. And it's worn down. You can see it. That's nice and easy. So great
Right.
description
Very simple.
about what happens and how you can see what happens with that 10 times, right?
Right.
10
10
times
times the amount of
more at
force at
night.
night because receptors
Wow.
are turned off. Yes.
And so again, if we don't address this, if we turn our head and don't look at anything, what can happen? What are some problems
So
that come up?
So there's a lot of problems from clenching and grinding, but as far as tooth wear is concerned, you can cause root canals. It can cause tooth sensitivity. It causes fractured tooth, tooth wear, and so on and so forth. And of course, all the TMJ problems that come
Right.
with that. So we're going to look at some extreme cases of when things aren't done over a lifetime of clenching and grinding. You can lose a lot of tooth structure.
Oh my goodness.
And when it's going, it's going. This is
Yeah.
it. This is the only tooth structure you're going to get. Here's another patient, right? So extreme wear with these cases right here.
Right.
And then we'll look at the next patient. This is that patient.
Same patient, right?
Same patient. Once you get through the enamel, you get into the dentin, and the dentin is going to erode much faster than the enamel, so it starts to cause puddling. So in an
Wow.
acidic environment, you start to lose a lot more tooth structure.
And so, in those kinds of circumstances, we see that you can't go back. So, you really need to talk to your dental expert about what to do in preventing those kinds of problems. And it's very interesting as we talk about this today. I'm in the process of getting my teeth stronger because of that very reason, because I've got some grinding.
Right.
And we're doing some things about it. So, I want you to know, Doc, I'm listening and I'm going to actually do something about it.
Good.
Yeah. So, what to do any kinds of repair on those teeth that have been worn this much? What do people do?
So once you lose that much tooth structure, you have to do enamel replacement, basically.
Oh, wow.
And then we do that with porcelain, basically.
Okay.
Crowns, onlays, stuff like that. Some people that have worn their whole mouth out need full mouth set of crowns.
Right.
This is that same patient that lost all that tooth structure. We go ahead and just repair or replace those teeth with
Oh, wow.
crowns.
All
Yeah,
with crowns right
yes,
there,
sir.
right?
It goes right on top of the tooth structure. And yeah, it's much more expensive. It would be much easier if you just catch this problem when you're younger, and you can save yourself losing a lot of tooth structure.
A lot of tooth structure,
And you
a lot of
simply do that
problems.
with a night guard,
Right. And putting a ninth guard.
wearing a night guard.
And even if people bite through those, get another.
Even if you bite through them, yes, over time, you shouldn't be going through them that quick.
Right, right.
But yes, so here's a picture of, what can be done. This is simply a piece of acrylic, correctly made. You wear it at night. It should be very comfortable. Shouldn't be a problem to sleep with. And it will protect your tooth structure and save you from needing much more extensive work later on.
Well, I want you to know I'm hearing you, I'm listening, and I will begin to address this problem. I've bitten completely through a night guard, and it echoes that point about 10 times more pressure that our teeth put on each other at night than we do during the
Yeah,
day.
see, nobody walks around during the day just clenching and grinding and
Right.
wearing out tooth structure. It happens at night when you're sleeping. You don't have any control over it.
Right.
Really don't.
It's kind of that subconscious type of
Exactly.
impact and effort when we feel that stress at night. Well, Dr. Walker, we thank you so very much for taking some time coming in. We thank you again for being our expert and some wonderful information about what can happen if you don't pay attention, how to prevent that, and the fact that everybody needs to go and see their dentist regularly.
Yes, sir.
Regular checkups, right? Very
Yes, sir.
good. We thank you for your time today.
Thank you, Keith.
All right, and that will do it for this segment of our expert here with HTV. Don't go anywhere. A whole lot more local programming right here on HTV.
Watch your mouth.